Today we are going to talk about a very important topic. That topic is the most common sport injuries at teenage and young adults. And it's so many types of injuries, but the most common is ankle sprain. And ankle sprain, everybody one day may have ankle sprain. And the definition of ankle sprain, that it's some sort of twisting or rolling of the ankle during daily activity like running, like jogging, like walking at home, at the garden. And this is a very painful issue. And by definition, it's just some sort of partial tear of stretch of the ligaments. And by definition, the ligament or a band, that is a band that connecting two bones together. So we may feel that after happening of this, we may have some swelling or bruise or pain. And the swelling comes gradually during the day after the onset of the twisting movement. And at the severe case, it may happen that some change of the color, like maybe reddish and something like that, and there is pain at the same time. And the very important issue, we have to differentiate the simplest sprain from a very severe injuries like sport injuries and fractures, in which there is a chip of bone or avulsion of the part of the bone which is very severe. But sprain is a mild pain, is a mild swelling, and sometimes change of color. What we are going to do immediately if this happen at home or happen at the playing ground, we call collectively the word like rise. We have to take some rest. Like during the training, we have just immediately to stop the training or the jogging or the running. We have just to have some rest for minimally 1 to maybe 3 days. And the other issue, we have to put some ice that will decrease the swelling. Other issue, we have to do some compression and elevation. And when we consider the issue of compression, is not that something very tight, because if it is too tight, it may cause other complications and it may cause problems. The other issue is elevation. We have to elevate the limb, because if we elevate the limb, this will decrease the edema, will decrease the swelling, and will decrease the inflow to that area, the inflow of blood. Putting in mind that this will be on the phase 2-3 days. After that, we may change the cold sponges or the cold ice. We may change to something warm the next week or something like that. Putting in mind that we are talking about the simple sprain, there is another terminology which we call sprain, and this may relate it to the muscle. Sometimes with very professional sport injuries, we may have some ligamentous tear, and this may need intervention from a doctor or intervention at a very special center. Actually, ligament sprain are grades, maybe grade 1, maybe grade 2, maybe more, maybe less. And grade 1 and 2, 1 is just a swelling and partial tear. Grade 2 is more severe and maybe associated with swelling, with massive bruise, with more disability. And at later stage, it may change into complete tear, which may necessitate surgical intervention. At the end of the day, ankle sprain is a common scenario that at every home, everybody may have this, and the good thing that it's completely will resolve and will continue our life. Thank you very much.